Alright, you guys, I'm going to stumble through this one the best that I can. It is a bright sunny day actually, and I'm really looking forward to summer, but I am cold. So this is probably going to be my last video for the month, and I apologize for that. I'm just going to be super busy till next month, so I will be back when I can, but don't get too worried that I'm not posting. So I wanted to go ahead and talk about injuries a little bit because we recently got a question in one of the groups about cauliflower ear and what to do about that. And that is probably one of the most common wrestling injuries. It's going to happen because you're not wearing headgear. It happens when you get an impact to that spot or you rub on the ear, and the cartilage will separate, and then the space between will start to fill up with fluid, and then you get this big balloon here. And I know a lot of wrestlers do look at that as kind of a badge of honor. It's something that happens in wrestling, and therefore we should just accept it. So if it's something that you don't necessarily want, because eventually, yes, it can rupture, it can continue to get worse. It's more likely to do that once it's kind of started. Obviously, prevention is going to be the best medicine. So wearing headgear and not using your head to, or at least your ear to leverage off of people as much will help prevent that. Oftentimes when people get that, it is because, you're doing like a single leg and you're putting your head against there and you're just putting your ear right against somebody's body and you rub, and that happens. So headgear obviously is going to be one of the first lines of defense that you can do. Once it's kind of started to happen, early treatment is going to be a big issue. Over time, the scar tissue will build up in the ear, and the amount that it's able to be treated goes down and down and down until eventually you're just going to have fucked up ears for the rest of your life. So what you're going to do when you have that, first you need to sterilize the area. You can use rubbing alcohol, you can use rubbing alcohol pads or whatever, wear clean sterile gloves, and then you're going to take a syringe, and I would recommend going with like a 16 or 18 gauge needle. When you are buying needles, which you can actually buy online, sometimes you can find them, there are fetish websites out there that will sell them. You might be able to find a medical website that will sell them to you. And if you are wrestling, that might not be such a bad thing to just keep in your house somewhere. You will want to have a sharps container, which is usually going to be a red container that it's easy to put the needles in, but you can't take them out, and it's not easy to open up and then put your hand in and get your hands into a bunch of needles. So once you, and I'm saying use 16 or 18 gauge needles. The smaller the number on the needles, the bigger the needle is actually going to be. And you don't want to go so small that you can't suck the fluid out, right? So you'll screw it onto your syringe and then you'll suck the fluid out. Usually they'll have a cap, by the way. Don't take the cap off of the needle until you're ready to go in. And I'd probably actually have a friend do the drainage rather than you do it yourself. If you're in a jiu-jitsu school, oftentimes your coach would be more than willing to and experienced in draining cauliflower ear. If you've been around long enough, you're going to see it. So you sterilize the area using rubbing alcohol or iodine or something along those lines. Make sure that your hands are washed before you put on your gloves, right? And then you're putting on sterile gloves, and then you inject in and then suck out, right? So I don't mean to inject air in, but you suck out. And you want to make sure that you're using a needle that is large enough that it can actually do the sucking. Because if you go with like a 27 or 25, which is going to be a very fine needle, very close to what they'd be using for insulin, you're not going to be able to get the fluid out. So you actually want to go a little bit on the larger side. Yeah, it's probably going to hurt. Probably because that area is going to be very tender already, and now we're going to stab you. But that you'll feel better afterwards. Once you've got that fluid out, clean it off again, right, to just kind of sterilize the area. And then there are magnets that you can get off the internet that are specifically they're coated so you're not getting the metal directly onto your skin, and then you just put the magnet on the ear, and that will kind of help prevent more fluid from going into that spot so that you'll have a more natural looking ear by the time that you finish. So now that we've kind of discussed cauliflower ear, there's no way that in a single video I can go through and cover every type of injury that will be common in wrestling, because guess what? every single injury on the planet can basically happen in wrestling. You can have concussions, you can have musculoskeletal issues, things like that. So we're going to go over as much as we can, or at least give you as many tools as I can, so that you can have a better idea of what kind of treatments are out there, how you do your early interventions when injuries do happen. For example, if somebody dislocates a shoulder, you're gonna want to do in those situations, especially if you can't get to a doctor right away, is that you would want to brace again. So you could actually use your foot if you want to, if it's like a shoulder or something, and then we do slow, steady tension that we add, and we put the shoulder into traction and slowly move outward until you get enough space away there that the ligaments and tendons can actually pull the humerus back into the socket where it's supposed to be. From there, you're going to be wanting to do rest, ice, and compression. Probably more just, resting and icing. With any type of soft tissue or joint injury, getting some ice on there really, really quick is going to help reduce the amount of inflammation and pain that you're going to be feeling. But I'm not a huge advocate for using ice long term. The thing about ice is that it's going to reduce inflammation in the area, which might be nice in the very beginning, but that inflammation is your body's cue that it needs to heal itself. So, once you're outside of like the first 48 hours, icing becomes less important, and then oftentimes you might actually want to start alternating heat with ice. If you don't have an ice pack, you can take a sock and fill it with rice, put it in the microwave for 2 minutes, and put it on and use that as a heat pack. You can do gel packs for ice in the fridge, in the freezer. When you do ice, make sure that you put a barrier between your skin and the ice so that there's not that direct contact. And elevation is kind of a little bit more of an old school way of dealing with stuff. It helps fluid to kind of stay out of that area so you don't have extra fluid that goes in there. The way that when I was with HOSA, which is Health Occupation Students of America, and when I was an EMT first responder, which, this is 20 years old information, but the way that the RN who was teaching us had kind of put it was that swelling is our body's way of immobilizing an injury. So if you have a knee injury or you have a broken bone or something like that, it's like a kind of a temporary flesh cast that stops that joint from moving so that the injury doesn't get much worse. But that swelling is very painful, especially if you have a broken limb or something like that. So you'll still want to kind of supplement that, especially if you can't get to the emergency room right away. So if you have a fracture, you can make a splint out of pretty much anything that you can put on both sides and then just tie it on, oftentimes with like fabric or something like that. You can just tie it on, just make sure it's not too tight, and we do whatever we can to stop that from moving. Obviously, hopefully if we're wrestling, we're in an area where we can get to the hospital as soon as possible. If you do have somebody that is severely injured, you don't necessarily want to transport that person yourself. It's a little bit better if you have another person with you. So basically what you would have is if you were to put the person in the back seat where they're going to be less of a distraction to the driver, you're going to have somebody back there with them that they can focus on them so the driver doesn't have to. You absolutely don't want to try to transport somebody by yourself if they are having any type of medical emergency. Generally speaking, if there is like a major transport issue, then you really, really do want to call that ambulance. But if you're not going to do that, you have to make sure that there's at least another person in the car with you that is not injured, that can actually stay with the injured person to keep them calm, to reassure them, to help them if there's something that causes their condition to worsen, so they can focus on that, so the driver can just focus on driving. That is, if you get in an accident because the driver is distracted, that's just going to make the situation worse for everybody. So, I'll let you be the judge of how bad the situation is. But, if it's just you and another injured person and you have the option of calling an ambulance, do not try to transport somebody by yourself if there's a major injury going on. So obviously the best way to deal with most injuries is going to be to prevent them. And so that means when you are rolling with somebody that you are tapping as early as you possibly can, that you are rolling with people that are people that you can trust to pay attention to the tap and respect that. You want to be, if somebody is a bit of a spaz and you're rolling with them, always go half the speed of the spaz, because when you try to meet their level, then they are cued to believe that they have to roll harder, and then they're going to spaz out more, and then you're going to have that to deal with on top of the spazzing that was already going on. But if you slow down your roll, the risk of injury is going to go way down. Your quality of your rolling is going to go way up. So they're spazzing out and you can't control what the other person's doing. But if you slow down, you're going to catch them on their mistakes. So there's a benefit to you to not going as hard as you possibly can, especially against the person that is just really, really aggressive, really, really going hard. That's just going to be, a recipe for disaster if you keep up with that. Corrective exercise, I am actually a huge advocate for that. I just did a video on posture and whether or not we should be trying to correct that, and I was kind of responding to Sean Nel-Giovanni, which I actually really felt that this was the most infuriating video that he's ever done, because he really, really was advocating against stability training at all. And when you're coming from a world where the only thing that matters to you is gaining as much muscle as possible, gaining as much size as possible, you are going to be blinded to the other benefits that come from different ways that you're going to train. So actually focusing on corrective exercise is going to be one of your best things that you can do. And on that note, I'm going to say this before I go into this, because as you guys have noticed, I have never plugged a product on this channel ever. I have actually been recently approached, and I've been approached a couple times throughout the years with stuff that's just nowhere close to being related to anything that you guys would be interested in. And I was recently approached by a video editing software company that wanted me to plug their video editing software. And I told them basically that if they want to have me promote their product, then I can put a little blurb in the video and you let me use the product, and I will maybe do a review video of it at some point in time. But and then the product will speak for itself as far as what you guys see as far as the improvement of the video quality here. But so I'm not sponsored by any of these books or tools that I am showing to you. In fact, I'm probably not going to show you the brands of the tools that I'm using. I've mentioned Gray Cook a few times on this channel. This is the layman's book that I actually do recommend that everybody buys and reads. This is by Gray Cook. It is called The Athletic Body Imbalance. It goes over some basic self-screening that you can do on your own. It goes over some corrective strategies, some good exercises in here. This guy is legit. He's definitely one that I would look into, especially if you are thinking about actually continuing to wrestle and being an athlete in any way, shape, or form. Because again, this is going to be one of the best ways that you can prevent injury, is for one, understanding what your body wants to do that may not be in its best interest, so that you can intervene and actually make those improvements so that you can avoid injury. If you wanted to go a little bit more in depth and you wanted to go kind of crazy and go into the dense version of it, he also has a book, I guess it's just called Movement, Functional Movement Systems. This is the course that he runs that is for personal trainers, so that we can actually do more thorough evaluations. So there are more evaluations in here, more corrective strategies in here, things that you can't necessarily do for yourself. So this is the more in-depth version. If you're a personal trainer like I am, then it's probably worth it to have in your library. But it's for the general population. I don't think it's necessary. So the other one, so that's kind of on the prevention side, is looking more at corrective strategies, understanding how your body moves, and being as strong as you can be so that you're supporting your joints so that you're less likely to get injured. Also, just not rolling with people who do heel hooks, because meniscus tears suck. Okay, so going into the more rehab side of things, I'm going to just go ahead and No, I'm going to go to this one first. So this is a book that I recently got. It's called Rehab Science, How to Overcome Pain and Heal from Injury by Dr. Tom Waters and with Glenn Cordoza. If you are familiar with the book How to Become a Supple Leopard, which is a training book that is really, really popular. I haven't read it. Jet has a copy of it, and I just haven't sat down and actually read it. But same author is involved in this one, and this is more of a layman's approachable reference for physical therapy. So once you have an injury, you just go here and you say, okay, this is tools, equipment, rehab. I don't see what kind of injury this is for, but it goes through the body. It talks about different stages of injuries, whether you have like muscle strains or you have muscle sprains or you have the padding tissue like I do, the meniscus tear. I recently have talked to a couple of people that have labrum tears, which is basically the same type of tissue, just in the hip rather than the knee. We have them all throughout our body. Unfortunately, if you have those types of injuries, you're kind of fucked. There's not a whole lot that they can do surgically to fix it, and all you can do is strengthen the muscles around it, and you're going to basically live the rest of your life in pain. But anyways, so they go through and they'll tell you like the basic exercises that they want you to do, and they're probably going to be very similar to what a physical therapist would give you if you were to have the injury and then have to go through it. So it's a really good book. At least the first couple of chapters are worth reading just straight through, and then the chapters following that are going to be more beneficial for you post-injury, so that you can be like, okay, what kind of injury do I have? Whether you have the diagnosis or not, oftentimes you can be like, oh, reading that and saying, okay, I can pretty much figure out what's going on here, and then you can go from there. I'm not saying don't see your doctor if you have an injury. You absolutely should always see your doctor so you can get a good diagnosis. If you were like in my case, the doctors did everything they could not to diagnose my knee issue, and then by the time I knew what it was kind of too late to really fix it. There's probably a lawsuit in there, except that with meniscus tears, there's just not much you can actually do. This one is another one that's kind of at least a good segue into the next subject, but it's kind of a useless book, especially when you get into the first chapter and then they kind of say, you can't use this book to actually practice what's going on in it, which is, this is called Release Your Pain, second edition, Resolving Soft Tissue Issues with Exercise and Active Release Techniques. And that's why I kind of pulled this one out and why I even have this book, is because as I've developed in my personal training and all that, I have become more and more interested in fixing people rather than just training them. And going through corrective and all that stuff. And so active release technique is one of the most effective methodologies that I have found for treating any type of muscle injury. And there's another book I didn't pull out, which we do have, which is the Trigger Point Therapy workbook. And so what a trigger point is, and why these two are kind of related, is a trigger point is where a muscle has an adhesion in it, which is where layers of muscle tissue basically heal and glue themselves together so they can no longer glide and slide. And that point may or may not actually cause any discomfort or pain. And that's kind of the theory behind trigger point therapy, is that because this point can't move the way it's supposed to, it's going to cause tension somewhere else so that another muscle can become strained or overworked, and then what you're feeling, and you think it's a muscle knot, is that strain being caused by this adhesion over here, but it's not in the area that you're actually feeling the pain. So the pain can either radiate from this point or it can just present elsewhere, probably because another muscle is having to pull double duty for this muscle that is now chronically tight. And so what active release therapy does, which is very similar to what trigger point therapy does, but it's kind of more of an aggressive intervention for that, is that they will have you hold a position, right? In this case, I might start like here or something like that, and they'll put like pressure between your scapula, and then you'll move through a range of motion that's going to move muscles around or the muscle itself that is you're trying to release, and you break up that scar tissue with that thumb pressure right in that spot. And when I've had injuries with my rotor cuff from people doing Americanas to me, my coach for a while there really wanted me to was trying to get me to really hold my elbows in, and when I was bringing my arms in, I wasn't bringing them in correctly, and so what was happening was that despite me thinking, okay, I need to bring my arms in to protect myself from Americanas, I was doing it in the wrong way, and so I kept hitting that Americana, and eventually that created some adhesions back here in my posterior shoulder socket. And so I went and I saw my chiropractor. The people that would usually do active release technique would be massage therapists, physical therapists, and chiropractors. And you can go to the ART website, active release technique website, and you can find a directory of licensed practitioners for that technique. And for the adhesions that I had developed in my shoulder injury, it was instant. I would finish my first session and I was instantly better. That hasn't always been the case. I've had Jaffer do various active release technique strategies for various injuries over the years, and some of them, it's 1 or 2 visits and the injury is completely resolved. If with some more complicated things like my torn meniscus and whatnot, its returns are a little bit more limited as far as what it can do for the muscle, because the muscle is not actually the issue. With the torn meniscus issue, so my quads tendon is doing some double duty there. My popliteus is doing double duty. This hamstring tendon is doing a lot of double duty here, and I've got tension along here that's doing a lot of double duty. And these muscles are becoming chronically tight because of how much they have to work more to stabilize this knee joint. And so, we can release that as much as we want to, but the underlying issue is the meniscus tear. So it's not going to work for every type of injury that you come across, but if it's a muscle related issue, it can definitely help. And, for the meniscus tear, it definitely can help over time as well. And I didn't bring it out here, but so I'll get to it in a second. No, I'll go right into it right now. The next one that I do recommend is cupping, and I've actually found that to be one of the most effective things for treating a lot of the pain that I've had with the meniscus tear. So what I'll do is I'll actually take lotion, I'll put it in the area that I'm going to put the cup, and it's going to be a vast area, so it'd be like from here to here, because this is actually a very common area for me to have issues. So the IT band is like very, very tight right now, as is this lateral quadricep, this vastus lateralis, which is your lateral quadricep. And so I'll put the cup oftentimes very close to where I'm having a lot of the pain. It's not going to get into the tendon as much, but you release the muscle, then the tendon won't have as much strain, right? So what you'll do is you'll suck up the skin into the cup. I'm just using a hand pump cup, and then you'll move it up and down along the strained muscle in order to release tension, so it puts less tension onto that quadricep tendon. Now, for muscles or the tendon like your IT band, it can be one of the more difficult ones to get through, just foam rolling and something like that, and cupping actually is one of the things that's more effective for the IT band and getting it to release. And one of the things that you'll see is that when you do cupping, if you get a nice smooth dome of skin that gets pulled into the cup, then that muscle's probably not too tight, and cupping might not be as effective. But if you start to see a little dimple, it'll give an M shape or something like that, the direction of the muscle fibers, that's going to be one that definitely is going to benefit a lot more from the cupping therapy. So that's just kind of a thing. And when you buy the cups, if you're going to go with this method, you want to have ones that have a little bit of a curve to them rather than the flat cups. usually the kits will have a blend of both, and you want to make sure that they have them in all sizes, not just the one that I have only has like the small cups that have that curve to it. But when you have a lot of your body is round, having a non-flat cup is actually going to be pretty beneficial to you. So there's another form of release that's in Asian cultures is called gunxia, I believe, and in Western medicine it is referred to as instrument-assisted soft tissue mobilization. And it's one of those things where, I haven't found it as consistently good as, say, active release therapy or cupping, or even dry needling for that matter, which you'd want to see a dry needling specialist. So if you have something that's chronically tight, dry needling can actually be very effective for that. For instrument-assisted soft tissue mobilization, which is the Western name for this, you would have a specific metal blade like this, and you'll put lotion in the area that you're working on, and then you'll be gliding across the tissue, and you're trying to find variances in feeling as far as like roughness or things like that. So we're kind of breaking up that soft tissue. You don't have to go super hard. It's really just a light scraping that you'll be going through that area. I actually have some area right here, very near the tendon right here, where I've got some fascial scarring and whatnot that I'm still trying to break up. And so if you get, sometimes when you go lightly in there, you'll still be able to get a little bit of what's called a petechia that will show up. Petechia is just a kind of destruction of the capillaries. And it doesn't necessarily mean that you are necessarily causing the inflammation in the area. But like your pressure on this, you should be able to go deep enough that you can feel that roughness, but it should not be so deep that it's actually painful. This only works for about ½ an inch to an inch deep in tissue. For deeper injuries, then you might want to go with something else. But that is hit or miss as far as the effectiveness goes, which is, I think, one of the reasons why my chiropractor actually uses it less. A note on chiropractors, they are very, very hit and miss, okay? And a lot of them like to use x-rays to, validate the work that they do. The thing is that chiropractors are generally not trained in x-ray, so it's actually a little bit outside of their scope of practice, and they mostly use it as a way of selling you on the idea of chiropractic. And if you have to like keep going in unless you've like been in a major accident like a car crash or something like that, going into the chiropractor all the time is, especially if they're not doing any type of soft tissue work, is not going to benefit you that much. Same thing with kind of generalized massage. It can be beneficial for certain things, but it's hit or miss as far as like just general massage. Sometimes, if you go deep tissue or sports massage, you might be able to actually release things and beat up the muscle in a way that will actually get it to heal better. But it's kind of hit and miss as far as its efficacy goes. And I don't know like really how qualified most massage therapists are going to be. I'm not knocking the entire profession by any means, but it's it's like personal training where you the individual's what's going to make it great. Same thing with chiropractic, right? If all they do is adjust, it's not going to help you. I'm just going to say that flat out right now. It's not going to help you if you just go in for an adjustment, because the reason why you're out of alignment is either that you've been forced out of alignment, or you have muscle imbalances or tightnesses and whatnot that are pulling your spine and joints out of alignment. And so if you're not going into and addressing the cause of that malalignment, you're just going to keep going back to that. So you really need to make sure that there is some soft tissue work that's going on in there. Otherwise, you're just going to be throwing your money away over the long period of time. Sometimes they'll just have you go and do massage, but if the massage is just general, or if it's not instituting like some rather uncomfortable techniques, then you probably are going to be seeing the benefit. Speaking of that, there's these little things. These are your, this one's like a sharper image. Like I said, I'm not plugging anything here, but this is a Theragun of types, and they have many different heads and whatnot, and it can feel good. It can loosen up your muscles a little bit, but this is going to be more of like a recovery tool. I don't know that I've ever found it to be particularly helpful for injuries. And a lot of the things that I haven't said yet is that these techniques that I'm talking about are a little bit down the road. So we want to be past the point of initial inflammation. We probably want to have professionals actually doing these techniques. This is more of an education for you, so you know what options are out there for you. Generally speaking, like foam rolling is going to help to a point. Some of these are going to help to a point, but if you're not having somebody that is really trained to go into and deal with these soft tissue injuries, then you're probably not going to see the relief that you're looking for. And last one I guess I'll bring up. I found that I have one of these for my feet when I started getting plantar fasciitis, and it actually helped quite a bit to kind of get me through that. But again, I've kind of covered that one, where plantar fasciitis is really an issue of tight calves and whatnot. Again, that's one of the reasons why we talk to really, really qualified professionals such as physical therapists and whatnot, because if we're looking just at the bottom of the foot, then we're not addressing the overlying issue. But this is a compression massager. Feels nice. It has some useless vibration that goes on in there. Same thing with like a Hitachi Magic Wand, probably not going to do much for you. I don't know how much I believe in vibration massage, and I kind of don't believe in compression massage. Now, I did find that when I came out of surgery for my kidney stones, they did have my legs in basically a compression massager. It will help kind of prevent blood clots and things like that can form when you've been laying still for a long period of time. There are benefits to it, but as far as like injury recovery, I don't know that the research is really there, or that it's really that effective at treating a lot of soft tissue injuries. So, the next side of this, and this is going to go back to, this book, right, is that exercise. Exercise is going to be, especially the light duty exercise, to kind of get the joint moving. If you are injured, sitting still and resting for too long is going to do more harm than good in the long run. You're going to lose range of motion. You're going to lose strength over time. So, when you get injured, I would not just, say, okay, I'm going to take the next 6 months off and never do anything. You really want to, especially when your doctor and your physical therapist say it's time to, you really want to start getting moving. One of the things that happens, and we talked about this again in the posture video, where if I'm sitting at a desk for a long period of time and I'm not moving, the synovial fluid in my spine is going to dry up, and then I'm not going to be as well lubricated when I do go to move again. Same thing's going to happen in a joint. So when you have a joint injury, if you immobilize it for too long, you're going to have atrophy that's going to go on there. You're not going to get an adequate lubrication in that joint. You're not going to get adequate circulation in that joint. So you want to get into light duty movements as soon as you possibly can, as soon as your doctor permits you to. And then from there, start working your way up to being able to do heavier and heavier and heavier. Just remember that you're injured so that you don't overdo it too soon. But you do want to get moving, right? The first thing that they want me to do for my knee is, just sitting on the floor and I'm just, doing leg extensions or gliding my heel across the floor, adding resistance as I go just by pressing my heel into the floor a little bit more, sitting and lifting my leg out to the side, bringing it out, things like that. And then other exercises that, may not involve the knee directly, but help strengthen the muscles around it. Very light duty squats, doing corrective exercise such as stuff to strengthen my glutes and things like that. These are all good things that we want to keep doing and keep moving as fast as possible. I will also say that, I am not a huge fan of naturopathy. I do understand that, we want to have a different perspective on healing, and it's a nice philosophy or fantasy philosophy that the body heals itself. We know that with HIV or cancer or any number of things that come up, meniscus tears, the body doesn't heal itself, and there's nothing that we can do necessarily to get the body to heal ourselves. If we have, type 2 diabetes, or we have something major going on, maybe that may prevent our body from healing itself because it's using its resources for something else. But a lot of the times what they're going to do is they're going to load you up with supplements that aren't going to do anything for you. You're going to spend a lot of money on it, and they're running on theories that are not tested. I actually just saw a video that was an interview with Dr. Mike and somebody else that had that they were talking about, you know, other worldly medicines versus Western medicine, and why Western medicine kind of tends to be king is because when people in Western medicine, when doctors you know, find out, okay, this therapy is not working, or the evidence doesn't exist, or here's this idea that we had and it turned out to be false, we tend to stop and say, that was false, we were wrong. And that is such a powerful thing that, you know, if your doctor says, I don't know, or, you know, we used to do that, but we don't do that anymore. And this was something that's just totally misinterpreted during COVID, is that we tend to immediately assume that they don't know what the fuck they're talking about. And the thing is that the way that science works is we do experiments. We gain more experience. And when new evidence is presented, we say, oh, maybe we were wrong about this. Maybe, and this was the example that they were talking about, is that, you know, meditation for depression or anxiety might be incredibly beneficial for people who are suffering from it. Yes, you may need to medicate in order to kind of get you to the place where you can meditate, right? But I have ADHD, so meditation's, you know, not going to work for me. Some people it does. It doesn't for me. I don't have the patience for it. But anyways, we, you know, have seen, oh, a lot of people who were suffering from anxiety, oh, there's evidence now that supports the idea that meditation actually has benefited these people. So science is always learning. We are always discovering new things. And it's okay to say we were wrong. And so, you know, that's kind of the thing with like doing PRP, right? This is a newer idea. It's been around since the 80s, I believe. And what we are discovering is that it is still hit or miss. And that's one of the reasons why it's not a mainstream treatment. But, you know, I found that when they were doing it directly into the tendon rather than into the meniscus, I had relief from that. A week later, pain that I've been dealing with for a year was suddenly gone, and now I could actually perform exercises that I couldn't perform before because it actually healed the tendon. People have found it to be a hit or miss depending on whether or not they address the underlying issues for plantar fasciitis. Some people have found that it to be actually incredibly good at healing the plantar fascia. But some people haven't, because they haven't dealt with the underlying issue that's causing the plantar fasciitis in the first place. Maybe they're wearing the wrong footwear, maybe they're sitting too long and they're not lubricating the joint or that foot to actually get the muscles to work properly. So it might be that kind of joint issue. There's a lot that could be going on there, which is why that might be more hit or miss. So, you know, as far as being a frontline treatment, we're working on it. We're getting there with stem cells. We're getting there with a lot of things. So we're discovering new bacterias that we can inject to an injury site that increases the inflammation in that. We used to think that we had to ice forever and ever and ever, thinking that and rest forever and ever and ever, thinking that was going to heal an injury. But now we're kind of finding, oh, ibuprofen, great for managing pain, kills the inflammation response, healing's going to take longer, right? So we will change our minds over time. There's a lot to still learn about how to manage injuries. There's probably a lot of stuff that I put in this video that may be old information. Again, you know, I haven't been a first responder for 20 years. And there are ideas that we have that, you know, we may find right now our first line treatments, you know, meniscectomies, right? They don't want to do them anymore because all it does is make the knee worse in the long run. So, you know, take everything I say with especially in this video, with a little bit of a grain of salt. I'm trying to give you ideas of modalities and things that you can look into, depending what kind of injury you have, some good resources for you. But also know that science is an evolving thing. And that's the thing that I think that we understood during COVID, was that, you know, we were being presented with a novel virus, meaning that we hadn't seen it before, and everybody had pretty close to the best intentions all the way through, and then some of that meant that they had to lie about a few things, and they got caught, and the messaging got all convoluted, and now we have a trust issue. So, you know, you live and you learn. So, I hope this is helpful for you guys. If you have more questions, if there's something I didn't cover, put it in the comments below, and I'll see if I can cover it in the next video. Alright guys, I will see you next month.